and it's different breathing and holding for every single one. Okay, so for all of these, we're going to use the 10 by 12 detector. Some we're going to use a right marker, some we're going to use a left. So, sorry. We still have to make sure we're in detent and all of that good stuff. And then at our 40-inch line here, there it is. And then we're going to bring the bed up to be the blue light, right? So that we know we're actually at 40. So let's start by adjusting that down. So the big important thing here when we're using this is how is our marker going to show up? So what we're going to make sure we do, we're going to make sure we leave our light field open 10 side to side so that the marker can go here in the mid section of the bucky on that right area, okay? So with that being said, we can collimate top to bottom because we're not putting the marker in the bottom corner, but we need to leave it open the 10 side to side so that it shows up there, okay? So for a sacrum, what is our angle?
15 to the toes.
15 to the nose.
Yeah.
So 15 cephalad. Okay, so 15 cephalad. And then our centering for this is 2 inches superior to the pubic symphysis. So I can have my patient turn his leg in and out. There's that greater trochanter. We know that that's in line with pubic symphysis, so I can go about 2 inches above that, okay? The other thing, his ACES is right here. It's about 1 inch to 2 inches below the ACES. So you can find either one. The goal is that we're centered within that pelvic ring so that we're seeing the sacrum, right? And we angle that 15 degrees so that we are flattening our sacrum out. Okay, so make sure you line your bucky up. With the 15-degree angle, I'm not worried about you guys adjusting the SID. You can leave this at the blue light and you can be at 40 on the tower. That'll be fine. When we get above like a 25-degree angle, that's whenever we want to make sure we're checking for that SID because it really changes at that point, okay? So 15 cephalad, 2 inches above the pubic symphysis. For this one, we're going to shield over the chest with the lap shield. The only thing you're not going to shield for is going to be the L spine, okay? So I'll give my patient that. And then collimation, you can be at 10 top to bottom, like a square, 10 by 10, okay? And then this one, just hold your breath because it's low enough down that we're not worried about diaphragm. We just don't want movement from the belly, okay? So AP axial sacrum, 15 to the nose or 15 cephalad, centered 2 inches above the pubic symphysis, okay? For the coccyx, what's my angle?
10 to the toes.
10 to the toes because you have 10 toes. So 10 caudal, same centering. So again, turn your leg in and out. Good, go 2 inches above that, you can relax. And then realign your bucky. I'm not gonna change any of my collimation or anything. Same thing, hold your breath, and that is your AP axial coccyx. So 10 degrees caudal, 2 inches above pubic symphysis, and hold your breath, okay? The lateral for this is no angulation. So I'm gonna go ahead and line this up. And I'm gonna have my patient. So first of all, I have to take this right marker out because he's going to lay on his left side and we mark whatever's closest to the image receptor. So right marker comes out. My patient's going to roll over onto the left side. Make sure that the entire spine rolls. A lot of times patients have a tendency to kind of not make the shoulder straight, so make sure they roll all the way. And then if you have a patient that doesn't have a bunk leg, you can have them bend their legs to kind of help support themselves for comfort. Okay, and our centering for this is kind of weird. You're gonna find the ACES, you have something in your pocket, and you're going to go 3 to 4 inches posterior to the ACES. So that's 2, we're gonna go 3. That's gonna kind of depend on your patient's size. So 3 posterior to the ACES, and then 1 inch down from there, okay? So you have to envision that the spine comes through, and so we're centering posterior because we want to be on that posterior portion of the spine, right? So here we can open, I like to open back up to 12 because we're looking at the entire sacrum and coccyx now. And then collimating front to back, we can go about 7. My left marker is gonna go on him in the anterior bottom corner, okay? So it'll have some magnification. I do like to make sure that it's still a sticky marker so it stays put and doesn't end up sliding into your anatomy. And with this one, we would hold our breath, okay? So again, find that ACES, go 3 to 4 inches posterior, and then an inch inferior to that, okay? Make sense? So that is your lateral sacrum coccyx combo, all right? So apiaxial sacrum, apiaxial coccyx, and then lateral of both, okay? For the SI joints, go ahead and lay back on your back for me again. The SI joints are not on this paper, but my other paper over there has it. So it is 3 views, but one of them is gonna be an RPO and one is gonna be an LPO. Okay, so we'll have an LPO and an RPO, and then the AP axial. What is my angle for the AP axial?
30 males,
30 males, 35 females. Okay, so if your patient is a male, you angle 30 degrees cephalad. If your patient is a female, you angle 35 degrees cephalad. Okay, so make sure you remember that difference. So I'm gonna angle 30 degrees cephalad. And we are centering 2 inches below the ACES this time. So I'm gonna find, first of all, we said over 25 degrees, we need to check our SID, right? Because we have quite a bit of change. So what I'm gonna do first is bring my patient this direction so that I can get on this side and actually come to the table. That phone's just in your way, isn't it? All right, so I'm at 42. And remember, you have to chase your light. So right there, I'm at about 38. So we know that there's about a 3-inch gap between the tabletop and the bucky. So if you're between 37 and 40, I'll be happy with it, okay? So my SID is fixed. Now I need to line my bucky up. For the AP, we can do what we did before with the sacrum and coccyx. I can put a right marker here in the middle and make sure I stay open 10 side to side. So we'll go ahead and do that. And then I'm gonna poke on my patient, find the ACES. And then again, we're going about 2 inches below the ACES at the midline, okay? So right about there. 2 inches below the ACES. I can collimate top to bottom a little bit. I'm gonna go about 7 top to bottom because we're just looking at those SI joints. So I'm at 7 and then 10 side to side so that we don't lose our marker, okay? And then 30 degrees cephalad angle, checked my SID, lined up to my bucky. And then hold your breath, okay? I'm good with that? Then take our angle off. And we're going to use our sponge. So when we used the sponge for the Jude days, we were angling our patient 45 degrees, right? Hand me that one, James. If you look at this sponge, I'm gonna get over here so I'll look at you can see. If we were to put it under my patient like this, it's going to angle my patient steeper, right? It's gonna angle about 45 degrees. So if I flip it over, it gives me less of an angulation with my patient. I said that backwards, huh? Yes. This is gonna be a 45 degree angle for my patient. And then if we flip it over this way, it's gonna put us at about that 25 to 30 degree range, okay? So I'm gonna have my patient roll toward the left, whole body. I'm gonna put this underneath, go ahead and roll back. Good. Keep this leg straight. Do you need to support that leg?
No.
Okay. Well then, yeah. So keep the leg straight with the pelvis so that we don't have our patient turn anymore and close that joint up, okay? So we want about 25 to 30. You can use this arm to hold the sponge. And our centering for this, let me take my marker off of here and line up. We're gonna center 1 inch medial to the upside aces. So he's in an LPO, left posterior oblique, but we're seeing the right SI joint, okay? So I'm gonna poke and find that right aces. And we're gonna center about 1 inch in from that upside aces. Make sure the shield's not in there. I'm gonna open to be about 10 top to bottom, 7 side to side, and then we mark the side that's up. So I need a right marker, and you can put it in this bottom corner right here, okay? And then just hold your breath. So 25 to 30 of angulation, 1 inch medial to the side that's up, and then we mark the side that's up. And that matters for this because we're collimating in and we're only looking at that right one, okay? So then we would do the same thing but the other way. So I would take this out and then have my patient roll the other direction. Roll back. Does that feel about the same?
Yep.
Okay, and then try to get both legs in line with each other so that you're not, there you go. And then I'm gonna find side up aces again, right there. And again, centering about 1 inch medial to that. And then now a left marker is gonna go over here because he's in an RPO, but we're seeing the left SI joint, okay? And then just hold your breath. And be careful your shield is not in your light. Make sense? Yeah? All right. So for practicum, you're gonna choose from T-spine, C-spine, L-spine, sacrum and coccyx, or SI joints. So it'll be 5 cards. Nothing will be a side because everything is bilateral. Okay?